here with us today. There we go. So that they can watch that back, or even any of you guys who might want to watch the webinar back, because there's some great information that's going to be shared here today. So on behalf of Texas Hands and Voices, welcome to today's webinar that we are doing in collaboration with the Department of State Health Services, and most specifically, our TEHDI, T-E-H-D-I, Texas Early Hearing Detection Intervention Program. We are doing this through a grant offered through the Department of State Health Services in hopes of increasing those local networks of support and providing you with information and resources to help in the work that you're doing with families all across the continuum of care, from newborn hearing screening through school services, as well as parents who have utilized those services. Part of the team that's here with us today is Lana Nissen, who's representing parents in the Region 7 area, Paulina Pena, who is representing parents in the Region 11 area, Tracy Stoanescu, who is representing parents and working in that Region 8, and our two presenters and collaborating audiologists, Dr. Karen Diddy and Dr. Sarah Wainscott. So we are going to turn it over to them. Sarah and Karen, thank you so much for sharing your wisdom with us today, and I'm going to turn it over to you.
Perfect, and I'm loading up a PowerPoint, and my hope is that you are viewing it now. Yes? Yes, here we go. All right, so again, thank you for your investment in your lunch hour today. We have a lot of information to share, and so we're going to go ahead and jump right in.
Sarah, I'm sorry.
Yes.
Just really quickly, it doesn't seem to be in presenter mode. We see two slides next to each other. Is that how you want it to look?
Not necessarily.
There we go. Yep.
Okay, that's working for you?
Yes.
Okay, it looks the same to me, so thank you. Thank you for your help there. And so our objective, and we recognize that we have lots of different people here and that are lots of different roles within that system. And so for some of you, this is going to be review, some it's new information, but really our objective is to start by reviewing 4 key concepts. This is why that TEHDI system is so complex. This is why it's so difficult. We also want, and that's going to be my job. Then we want to sort of tag team Karen and I to provide some practice guidelines for all of those stakeholders. And then Karen is going to walk through lots of really vital resources. And so I want you to think as you go through this presentation, you're going to see lots of information. Here's the good news. You don't have to hold on to all of it. We are going to disperse it back to you, and it's going to be full of QR codes so that you can go right in and click to whatever those resources are that are well matched to what you need, right? And so we hope, again, that we're going to help you identify what the problems are, what you can do, but also give you the toolbox that you need to help our families. So asking why is it so challenging? Well, here's the thing, that the kids are tricky. We want to walk through the specific needs of the children that we're talking about. Providers are challenged. We want to talk about why this can be so difficult for providers. That TEHDI system is delicate. It's a multi-step system. We want to walk through that a little bit. And then families, families themselves, limited resources and diverse needs. And so it's my job to kind of hit on the 4 of those items. In terms of our children that are deaf and hard of hearing, we refer to this as a low incidence population. We know that it's in terms of a birth defect, it's high incidence, but really only 2 to 3 infants per 1,000 are deaf and hard of hearing. I would note that by age 5, that number has grown to 4 to 6 per 1,000. And keep that in the back of your head, because what you need to remember is that newborn hearing screening is not enough. We do have progressive hearing losses. And in part because there are not that many of those kids, we are just not familiar as a general service system with how to address their needs. And their needs are really different. So those hearing differences can range from mild to a profound hearing difference, right? And we know about a third of our kids who are deaf and hard of hearing have additional identified disabilities. So these kids often have medical issues or developmental issues. And I say that because it's complex. You've met one deaf kid, you've met one deaf kid. They all have really different needs medically in terms of their hearing and in terms of their families and what they're bringing to the picture. We talk about hearing differences being invisible. And what we mean by that is that when I've got a baby who's deaf or hard of hearing, they look pretty much like a hearing baby that's typical. You know, a 6-month-old is not talking, right? A 6-month-old or a 3-month-old or a 2-month-old is not doing a ton, right? They sleep a lot. And so we don't necessarily recognize that just developmentally. We also, like we mentioned, those hearing differences are sometimes progressive, and we want to watch for that. 95% of these children are born to hearing families. So this may be the first child that they've ever met who's deaf or hard of hearing. And it's simply tricky to navigate. We also know that hearing is not standalone, right? The way that we access language affects not just language, but cognitive development, social emotional development. So when our children have a hearing loss and they're not accessing language, either through technology or through sign language, we consider that a developmental emergency because failure to access language reduces not just their language access, but their cognitive and social emotional development. It is a developmental emergency. And it is tricky, particularly here in Texas. And you guys, I mean, you live here, you know this well. In Texas, we are the second largest birthing state. We birth close to 400,000 babies per year. So even if we're talking about only 2 to 3 per thousand, it's still a lot of babies. We have the largest rural population. And when we're talking about access to services, a rural population has more difficulty accessing those services. I don't have to tell you, we have record levels of immigration, right? So that brings in a whole influx of families that are particularly challenged. And, you know, how those systems and services, you know, are complicated by this population. The reality is those children are here. And we have to figure out how to serve them. We have more than a third of our children in Texas on Medicaid. And we're going to talk a little bit later about some of the particular implications of that. We also have the highest number of uninsured children, right? So all those things are difficult. We talk about loss to follow-up. And the concept there is, hey, maybe that baby got screened. We do a great job of hearing screening and then newborn nursery. But what happens after that? So for that baby that refers to that second screen or to the diagnosis or to intervention, we lose a lot of those babies in Texas. And we're never quite sure, honestly, if they didn't get the services or the services were provided and they just weren't reported. It's really hard to distinguish between loss to follow-up and loss to documentation. But in terms of who we lose at that point from screening to diagnosis, here in Texas, we lose more than half, right? We lose 52%. And that's significantly more than other states. That number is 21% nationally. Right? We know that intervention is a game changer. What we know from research is if we're able to have intervention, and we're talking about technology or sign language or sign language services, all those things, if we can get that support in by 6 months, man, we can change the trajectory of language and learning from that for that family, for that child. But when we don't identify and we don't refer, we don't get to intervention. And of those babies that do get identified, we still in Texas lose 61% at the point of intervention compared to 16% nationally, right? So we've got a lot of work to do. And we also recognize there are barriers even within families. And so sometimes that's language and literacy. So it's harder to communicate with those families. Sometimes it's financial challenges, or they're concerned about reporting. Sometimes families have limited access to services. Some of that's based on geography. Sometimes it's transportation. And then sometimes they simply don't have the same understanding that you and I might have of hearing and the implications for learning. And when we have information, regardless of that family's background, every family functions a little differently, and our readiness to move to that next step can really vary. And so we want to come alongside those families as much as possible and help them be ready to get to that next step. We also recognize that just Teddy itself, this is a delicate multi-step system. If you've been with us before, you may have heard a quote that we had from a family that was in a focus group with us. She had a child that was medically involved and had navigated a number of systems and services. But the quote we took away from her was, "It was easier to navigate a heart transplant for my son than it was to navigate a system to address his hearing loss in Texas," right? And so that's a big deal. And so when we think about that process, why is it so complicated? Well, we know it begins with screening, right? And that birthing center. But you need to know, if you don't, that often involves 2 stages. And so they screen, and then they're going to get a second screen before they get to the diagnostic stage. And we know that that's best practices because, man, it's hard to get that ABR. And so we want only the children that actually need that ABR to be referred there. It is expensive, it's time consuming, there can be waits. And so we want to make sure that the people that get those slots actually need them. So we have a 2-stage screen. But again, that means that family has to come back a second time for a screening. We know based on our population that sometimes the infant's first and even last name can change from the screening, even to the discharge, even to that next referral. We also, as we track those babies, we follow along and depend on their connection with a primary care provider who can often change. Often the primary care provider that's documented in that birthing center is not actually somebody that serves that child, right? So that's a problem in terms of tracking. When we are trying to ensure proper scheduling, and I'm thinking, man, if I missed a dentist appointment, I get like 85 texts, right? Like they are on it. And so we want that kind of vigilance when we think about our newborn screening system. And often to ensure that if we can get several points of contact, can we get your cell number? Can we get your work number? Can we get grandma's number and permission to talk to grandma so that we can ensure that we're able to reach out when it's time to make that scheduling appointment for that next step. Based on the etiology, the cause of that hearing difference, an infant could have other risk factors or medical issues, and that can complicate our scheduling, right? And so a family that's got multiple medical appointments, we just said, hey, that hearing loss, that can be invisible. Well, there's some things that are readily apparent, and sometimes that parent is more ready to take action on those other medical issues, and that hearing issue gets put off. We also see families miss those outpatient screening, that second stage screen, because the mom and dad have moved or there's changes in that contact information. And so again, that idea of having a connection, a consistent way to follow up on that family is going to be critical. Apart from the families, we know that our providers are challenged. And we know that providers get in the business of providing because they want to serve families and children. But we know that it's complicated. Even as we think about who are the providers, we acknowledge that everybody who provides clinical or educational services is a provider, right? But we also know not every provider has the same training or background experience. So we have some folks here that are, they work for the Regional Day School Program for the Deaf. This is where they live. they've worked with these deaf and hard of hearing kids for a long time. We also have early intervention providers who may see one in a blue moon, right? And so we know that they don't have the same background experience. Our primary care physicians, right? We think of them as sort of the cornerstone of our health system. But a primary care physician typically encounters only 2 to 3 children who are deaf and hard of hearing in their whole career, right? So they don't have the experience base, and often that physician is learning alongside that parent. There's shortages of audiologists, especially pediatric audiologists, and we know that that's more pronounced in rural areas. And so again, we emphasize the importance and the urgency of getting to that diagnostic assessment, but that parent is stuck because there's simply not an audiologist within 200 miles. And in a minute, I'm going to show you a map that kind of illustrates that. The reimbursements for Medicaid patients are really low, right? And shamefully low, many of us would say. And we just got done saying, hey, more than a third of our kids are on Medicaid, and we also have a lot of uninsured, right? And so most practitioners, when they're seeing that Medicaid kid, they're operating at a loss during that session. And so while a major hospital may be able to absorb that, smaller providers simply can't if they want to stay in business. And so that's a barrier. Equipment is expensive. And the staff is limited. You know, even as we talk to providers, what's the issue? The equipment was broken. It's not fixed. You know, somebody left. We can't afford to do this or that. Well, all of those things delay that diagnosis, because if the equipment and the provider is not accessible, then we can't get that auditory brainstem response test done. That's the diagnostic test that we need, and it requires specific equipment and specific training. Here's what we call a heat map, and we have to give a shout out to the folks at Lamar. This was developed by their AUD students, their audiology students, and shared at the Texas Academy of Audiology this past year. It's what we call a heat map. So you see two different things. You see concentrations of population, and then you also see audiologists. And I want you to note that it says Texas audiologist. It does not say Texas pediatric audiologist, right? So this is not even our pediatric folks. These are just general audiologists. We have fewer than these, right? And so look at some of those high areas of concentration, and you see, you know, some that have audiologists and some that don't. In fact, if you took your finger and went right down through the middle where that red line is, you would be tracing I-35. But the further you get away from I-35, the more difficult it is to find an audiologist, particularly a pediatric audiologist. Our Teddy system is challenged, right? So, you know, we are here. We are funded by Teddy, and they are clearly invested and have been for a long time. But there are some real significant barriers that our system folks are facing. So, for example, when we think of screening, and my counterpart, Dr. Diddy, often says, man, that's the first domino. We got to get that right. We got to get the screening right. And she's right on that. And so depending on who screens and how it's done, we see turnover. We see inconsistencies in terms of training. So one of the things we're really going to push is training for those screeners, and certainly the NCHAM training is the way that we would direct you. Families and providers don't always communicate effectively. We hear this from our families often. My provider is not clearly communicating with me, or they're not communicating with empathy, which makes it hard for me to absorb what they're telling me. We know that referrals are unclear, and that they can really vary by location, by the person's insurance, by their access to transportation. So there's not just one way to get to the next step. You know, one of the things that we talked about is the fact that these kids have different medical needs, different levels of hearing, and, you know, all of these different things. Well, that makes the referrals all the more complex. We've talked about personnel shortages. Well, that really relates to longer wait times. And when we want to get them in that window, that 1-3-6 window, The wait times really complicate things. And frankly, it got even more complicated during COVID. And we're still catching up in terms of systems and services. We're going to be honest, that MIS system is a bear. And so we often, just like we hear from families, man, I have trouble communicating with my provider. We hear from providers, I have trouble with that MIS system. And so we acknowledge that, and we know that that's something that Teddy continues to work on. And we're going to give you some workarounds today. Referrals don't always result in reciprocal communication. And that's something we hear from our providers who do make referrals, that I pass that information on, I've referred that child, but I don't know what happens. I'd like to hear back. And so that would be another encouragement for you. And one of our objectives in this whole project is to develop these robust micro networks of support, and that reciprocal communication is a part of that support. We also know as that child goes from parent infant to that regional day school program at age 3, that we would like to see kind of a seamless transition, and that doesn't happen often. In fact, when we meet with the coordinators of those programs, we'll often hear that story, man, all of a sudden I have 3 4-year-olds who are deaf and hard of hearing. I didn't know that they were coming. We would have planned it differently. And so we want to make sure that there's a more seamless transition from ECI to that regional day school. We also recognize that families are really different, and you guys know this, but they vary in terms of what their needs are. We know that those families that are undocumented in particular may feel hesitant about going to medical appointments. And while we know that that's not a concern in terms of reporting, the family doesn't know that, right? One of the things that we would say to providers is that often this is a great way to insert that family to family support. Having another family come alongside them that looks like them, that speaks their same language, and that shares their culture may be able to help that family be more comfortable with following up with those transitions. So, a plug for that guide by your side, that there's a way to help facilitate that. Those other medical needs can take precedence. And we also recognize that perspectives on disability, like what's the cause of it? Those things can be influenced by culture. So there's a stigma sometimes that maybe you and I don't have, but these other families do. And again, that parent-to-parent support can be really important. And then, we've plugged again the scarcity of those pediatric audiologists. And when I have to travel long distances, if I have limited access to transportation or childcare or all of these other things, simply getting there is a barrier. One of the things that we're going to encourage you to do is really, we call that a handoff, where I sit down with you. Where are you going to that referral? Let me find it for you. Let me identify how you're going to get there. Let's walk through a plan. This graphic was shared a number of years ago at our national EDI conference, and I think it's helpful. Here's the concept. They have to navigate this pipeline, right? And that's complicated. And so we are not going to be able to fix every problem today. But what we want to do is equip you to plug some of those leaks. And so if we can identify what some of the problems were, identify some resources for support, and our objective again is to hand you some tools to help plug the links. And so that's Karen's job, and here I do the handoff.
Well, it seems almost hopeless, doesn't it? All these problems, all these difficulties, but what we have learned across the United States over time with the early hearing detection and intervention program is that small steps of change make huge differences. How can we do that? Well, one of our perspectives are these micro networks to work within the regions for you guys to develop networks within it, because Texas is just huge. So I am going to encourage everyone to look at the TEDdy information and training materials we're going to provide, but also the NCHM, which is the Newborn Hearing Screening Training Curriculum. Now, this is when all of our QR codes come into place. Remember, you're getting a PDF. You're going to be getting something to look at. And I kind of want to encourage you to make a notebook, because not unlike physicians, you may only see a handful in your practice of children who are deaf and hard of hearing, but obviously you're going to see many more because you work with this population. The newborn hearing screening training curriculum will guide you through the process. You don't have to take it as a course. You can just look through the slides. I want to encourage you to do it so you understand what the process is. We often think it's just screen, they don't pass, refer. It's much more complicated than that, and there's a lot of steps involved. So please look at that. So this will be rich in resources on purpose, and so we hope this will help all of you so we're all on the same page. It's important when you see these children in your practices or you're helping them navigate the system is to get complete understandable communication. If you need to find somebody to speak to them in their own language, that's very important. Make sure all the updates are provided, new address, new phone numbers, different emails, that type of thing. Connect these families to the Texas Guide by Your Side program, parent to parent. It's the only family support network in Texas. Equip and utilize these new dishes patient navigators that we're training and getting involved, coaching parents clearly through the next steps. And I'm going to be providing you some resources to help you to do a better job at that. I want you never to assume that everything has been already put into MIS. Sarah made a very good point. We don't know if we're lost to documentation or lost follow-up. So it's really critical that you go back in, update information, because typically a baby who's screened, and I know this, I ran these programs, we would put baby girl Smith. That was mama's last name, and it's a little girl. If the baby did not pass, I would try to go back and fix the name, but that's not traditionally done. So these babies get lost. They get referred to a different kind of provider, not the provider that the family told us. So if you see this child, be sure that information is updated. And again, if you get stuck with MIS, there are people who will help you get through that, but also we're going to give you a couple of workarounds for that too. Thank you. This is the list of Texas state agencies. As Sarah often mentions, I've been around a long time, and I can guarantee you 25 years ago, this wasn't available. We now have an amazing amount of resources available nationally, but specifically in Texas, some wonderful links. And so if you go to this QR, you'll see a definition of each of these programs that are available. Pretty cool. And they all provide different aspects and services for families who have children who are deaf and hard of hearing. I want to encourage you to look at that as a resource. Go ahead. I know there's a lot of different people on the phone call today, including families, but I want to talk, stakeholders is going to be my umbrella for all of those who don't come below. Please review the educational material list. If you're a parent, you'll become better informed of what's available for your child. If you're just a receptionist at an ENT practice, you'll learn more about how that doctor can get those people the service they need. So become better informed on all that. Print the acronym list for the reference. Now, at the end of this PowerPoint, you'll see a list of acronyms. It's huge. But we're also going to provide you just a PDF with all of it on. Again, put that in your notebook of information. So when you get a report and you don't understand what it's saying because it's filled with acronyms, shouldn't be, the audiologist should spell it out, but if it's full of acronyms, you'll understand what's being said, and you can help your families navigate that information. A really good, succinct place to go to is the CDC website. It reviews hearing loss in children across the United States. It explains a lot of things really nice and succinctly. So another great resource for you to learn a little bit more. Early childhood interventions and speech pathologists, it clearly explained the services that you provide to families and connect the families with the services they can receive. We have some issues where an ECI person will call a family and the family will turn them down. Well, then that's it. Hang up. I think sometimes families don't realize how wonderful those services can be and how much they can help them, even if a hearing loss has not been identified yet, because it'll help them navigate that system. As we said, it's a little complicated, but it can be made simpler with wonderful people like you out there. Physicians, ENTs, primary care providers, I would really strongly encourage you to go to the website. You will see the link here in just in another slide where it's a good video. I honestly didn't even know it existed, so I'm really excited Texas did this. It's been around for a couple of years that talks about how to report and how to get information from MIS and why it's important and what the necessary aspect is. The MIS system is a hub where we can think of it as My Chart or one of your other doctor programs where you give somebody permission to get access. If everybody gets that information into it, then we'll spin a lot fewer wheels and get the services we need. Screening managers, screeners, I'm going to go back to that newborn hearing screening training curriculum. It has been updated several times. The most recent was just about a year ago, and I would strongly encourage you to go look at it, learn more about it, understand, and I think all screeners should take that so they have a better understanding, not on how to use the equipment, that's taught by you managers, but on what the process is so communication is better. They're not coming in and just doing their job. They need to understand. There needs to be empathy involved. There needs to be good ways to communicate to these families so they're not frightened, but neither do they take it as, blow it off. Deaf educators. My sister's one, so I have to respect this. Meet with stakeholders in your region, inform them of your role. Let them know. We don't want you to be surprised that a new baby comes on your roll and you didn't even know they existed in the pipeline. We should all be as part of in your network. And again, this micro network. Texas is too big to do it any other way. So in your micro networks, communicate to each other, help families understand that transitioning period and let the early childhood intervention, speech pathologist, whoever's working with this child meet with you and everybody try to work together a little bit better. Audiologists, I'm always going to harp on you, but that's because I'm an audiologist. Please go and look at the standard of care, the 2019 standard of care. It was updated just again prior to COVID, so we were dealing with a lot of things at the time. At that point, they wanted to change it from 136 to 123. Then COVID hit. Identification at 1 month, diagnosis by 3 months, intervention by 6. The research does indicate even those guidelines work extremely well for families, and we need to make sure those targets are met. Update the MIS system. We don't know that you've seen a child. This child may have gotten to you through a different course, not from the newborn hearing screening program. Make sure that information's updated in the MIS system. Make sure you put in name changes and addresses and extra context. I can't stress that enough. Go ahead. So the advantage of the system, and I've talked about it, it's like a hub. It streamlines our workflow. It enhances the coordination. We get access to data so we can find, oh my goodness, this hospital's having some problems. Their referral rates out the network, or this area doesn't have any audiologists. Standardized protocols, less paperwork. I know people have said it's very complicated. Truthfully, it is and it isn't. Once you learn the system, it works very, very well, and it's pretty robust. But we can help you get that information in a little different way with the old-fashioned paperwork. But I would really encourage you, if you see these kids a lot, work with them at, not Oz, but whatever their new name is, Revity, I think it is, and they will help you get through the process and make sure your information is reported. These are the Texas regional educational materials I was talking about. I know this is a lot of information, but I want you to understand that Texas has done an awful lot to help make this process work. I think where the breakdown is, it just doesn't go out to the communities as well. So they do support the training curriculum, but also the screener sensitivity training video. We hear a lot of horror stories from families that indicate that maybe they were told, oh, not to worry, probably just a little fluid in the ear. And so they don't take it seriously. Or they frighten the parents, say, you need to go in right away and you've got to see it. Your child has a hearing loss. Well, that's not true either. And I want to stress for all people, all of you, we know, we already talked about 2 to 3 per 1,000 at birth are born with hearing loss. Well, that there's a much larger number that don't pass the initial hearing screen, not a significantly large number, but a little bit larger. So we never want to frighten a family. We just want to direct them to get the services they need to rule out any concern. And there's some great resources for nurses and other healthcare providers. And Teddy MIS viewing the trainings that are offered. So a lot is there. Sometimes maybe it's a little hard to navigate the Teddy website, but boy, it's a wealth of information. I would strongly encourage you to go to these resources. This is the video I was talking about that I just discovered. It's Ask, Look, Act, Report, and it really is a good little video, and it really shares how physicians, primary care providers, sometimes midwives do the follow-up and provide some of the services early on in an infant's lives. This would be a great place for you to go and look and report, and that would be midwives as well. Results need to be given for all. I think it's 1% to 2% of our population are born with midwives. It might be a little higher, but those individuals need to be doing this too. So reach out to those midwifery programs within your region. Help them, bring them into the fold so they understand the importance and the value of doing the newborn hearing screening and making sure these kiddos are found. Can't emphasize it enough. Here's the QR code again. Go to this website. It's not just for audiologists. There's a whole section for deaf educators, speech pathologists. It also lists risk factors. That's a little bit more than we can talk about today, but we've already made it clear hearing loss can change over time between a child's birth and age 5. So that first newborn hearing screen doesn't mean all things work out. We know kids have ear infections. God knows I do. Mine all did, but hearing loss can also develop over time. So really important that everybody look at those risk factors and again, print it out, put it in your notebook. Texas has developed an excellent handout for parents and for you. Again, you can go to the QR, you can download this, provide it to the families. It's a very nice chart that helps them say, what are my next steps? Okay, what is the next thing I do? And it doesn't matter how many copies they get of this. If a speech pathologist sees the child, if the audiologist sees the child, if one of our wonderful individuals who are helping us shore up this loss to follow-up problem sees the child, please provide it to them because it helps that family know what the next steps are. Sarah's right, we get a lot of text messages and things like that, but some folks like the paper. And the paper tells you clearly in a kind of a non-scary way. They've developed a really great brochure. This is just a picture of this brochure, but Teddy has developed this brochure that talks about connecting families with services and support. It has information on it that can be given to your families. So again, go to the QR site, download it, and it'll be a great resource for your families. Again, we're giving you a lot of resources, but I don't think everybody knew how many were available in Texas to support our children. And we want to support you too. We know you're not all audiologists. You're all kinds of people out there working with these children. Never assume they know everything and never assume they've received everything, and it never hurts to give it to them twice. So I would strongly encourage, again, put it in your folders and you can give these to your families if it is applicable. These are some of the forms I was going to talk about. There is an outpatient reporting form. So if you don't see that many kids and you're an audiologist and you see them and you want to, or maybe let's say you're a pediatrician who's providing second stage screening. It's not often, but it does occur. Please fill out this form and submit it. You can fax it the old-fashioned way to the number on the screen, or you can go to Oz. I think there's a new email. This one hasn't been updated. The next form has been for assistance about how to report it electronically. Simple, easy, gets the information. Notes and recommendations, please put in there any obvious changes. Say the names have changed, mother's moved to this location, et cetera, et cetera. Go ahead.
And this is Sarah. To be clear, if you're reporting to the MIS, you don't need to fill out this form. But sometimes we have folks that have difficulty getting into the MIS, or
Mhm.
have trouble with it. And so this would be the alternative. If you get stuck, you can still provide that report.
Right. Let's go to the next one. And this is for the audiologist. Again, I want all audiologists to go into MIS and learn how to use it and submit their information. And even if you saw a patient and you didn't get any results, please report that you saw the patient and that you didn't get any results that time. At least the people who are trying to find these kiddos will not spin their wheels on a child's already being seen and served. So don't assume, oh, well, I still don't know, I won't report yet. Don't do that. Put it in there, because it could be they won't come back, but at least we know something was attempted. It's a very simple form. So if you're having roadblocks, this is fine. Use this form and get it in, because all of this information makes a huge difference in us finding these babies in Texas. Go ahead. I'm going to talk briefly about national resources, and I'll go a little more quickly through this. I don't want to belabor the point. EddiePals.org is a great new website. Not new, it's been updated, it's changed. And what we've done is kind of provided carrots for families and for audiologists. And within this is a robust amount of information. If you're an audiologist who wants to become a pediatric audiologist, or if you're a pediatric audiologist anyway, go to these. These aren't just documents. There's videos, there's training, there's parameters on how to set up your ABR. There's everything you possibly could need to know, up through hearing aid fitting, electroacoustic testing, et cetera, et cetera. So please go to this. You don't have to do babies from 0 to 3 to sign on. You may see a baby at 3 years of age and up. That's okay, because the way you fill out the form, it kind of screens you as to what age range you see. So then when parents look it up, families look it up, doctors look up, who can I send this baby to? They'll know which audiologist can provide what services within their brick and mortar. So please use this as a great resource. Go ahead. And then families. This goes to a lot of websites. It's not just at the eddie.org. Within this document, families can find resources for something as simple as how to put the ear mold in my baby's ear. So this is a great resource for your families, and I just encourage you to put it in your notebook so when families need help, they'll know where to go. One website that is noted in the eddie.org is babyhearing.org. It's a very well vetted website. It's been around a long time and it is excellent. I cannot recommend it more. It's great for families. Universal, so my kid didn't pass the newborn hearing screen. What are my next steps? And it's well done. It goes even to the point of describing what a hearing loss sounds like and what are the different kinds of amplifications and communication modalities. It's all done in a non-biased way. I'd encourage you to use this as a great resource. Go to the next slide. What's exciting is it's all in Spanish as well. This is a Spanish version. This is perfect for Texas because we have such a large Hispanic population. So it's in their language so they understand it better, and then they can become better informed. We know a better informed parent will provide good decisions. Go on. So we need to build these robust networks. We need to share data across proactively. Designate a case manager who also does a deliberate handoff to whoever is about to see this child. But everybody needs to communicate. Now, yes, we know HIPAA can be a bugaboo, but get permission. Get signed paperwork that says I can share this information with this other audiologist or this deaf educator or this speech pathologist or this early interventionist. Please work more within our silos, not in our silos, but outside our silos to communicate better. Great communities to keep each other educated and informed. I can't stress more about the statewide outreach center at TSD. We've also talked about Texas Hands and Voices. Leverage this collaboration and training. SOC has a wealth of information on their website as well. So I really strongly recommend utilize our Texas tools, basically. Go ahead. And we need to enhance proactive support, facilitate parent-to-parent connections like what we have with Texas Hands and Voices. It's a safe place for families to go to. We have Spanish as well as English, and it's a great resource to send your families to for helping navigate as well. So I recognize there's different groups that can help navigate that parent, but we should all be navigating in the direction that only improves services for this child. So utilize the statewide outreach center at the Texas School for the Deaf. Enhance coordination with ECI, even at the screening level. They may be screened, they may not pass that newborn hearing screen, but if they know they can connect with ECI to get to the next steps, that's what ECI does, and they provide a wealth of help. Clear, consistent messaging in their native language. I think that should go without saying. Plan visits with coaching on preparation and transportation. If a child is scheduled for a diagnostic evaluation 2 hours away because there's nobody closer, make sure that family, the audiologist should be doing this, but it never hurts. Make sure that family knows, hey, this baby needs to stay awake the whole time because when they get there, we need them sleeping for the evaluation. That way, there's no repeat visit because the family, the baby woke up during the thing. Did you come on for a reason, Sarah?
Yeah, I just wanted to clarify a couple of those resources for folks that haven't been to one of our presentations before. In terms of what Texas Hands and Voices does, like Karen said, we're a family-based organization. So we provide the guide by your side service, right? So where you've got a parent who's coming alongside, who's been trained to coach another parent. We have deaf or hard of hearing guides for families who haven't met another adult who's deaf or hard of hearing. We have resources, advocacy, webinars, trainings, all kinds of things, you know, from Facebook sites to local events. And so we'd love to connect families there. And then that statewide outreach center, it is based at the Texas School for the Deaf. And I think that can be deceiving because that seems like, hey, that's when the child starts going to school. But the outreach center is really for all of the families of children who are deaf and hard of hearing who don't go to the School for the Deaf. And so they have a range of services from, you know, online sign language classes, family weekend retreat every summer, and just a wealth of resources and information and a contact person who knows the state and the services throughout Texas. And so, yeah, the QR code for that was in the previous slide. But yeah, just wanted to reiterate what those programs do and why that they're so critical.
Yes. Guide for parent professional partnerships, having a culture of self-reflection. Look upon yourself, look at your own biases. Don't share your biases with the family. Be open to what they want to have information on. Provide them information around communication modalities that is unbiased at all times. And I know we all have our biases, but it's important not to do that to a family. They need to make their own decision because what works best for their family is what's best for the child. Actively listen to the parents, validate their concerns, express an understanding, foster that non-judgmental and compassionate approach when you're talking with them. It's called empathy. And we get busy in our worlds and we're seeing patient after patient after patient, but we have to recognize this is pretty scary to parents who've never experienced it in their lives. So we need to be a lot more thoughtful when we speak to these families. Just-in-time resources, I won't go into detail, but this is a really great brochure you can download as well to hand out to your families. It covers all the essential information, and a lot of these websites I've already talked about and kind of describes what that website says. Go ahead, next one. As you see, it gives us more family-to-family resources outside of what we've already talked about today. Go on. More. Eddie Powell's, Gallaudet, Alexander Graham Bell, Deaf Children. I think it's important to have this handout. Families are going to be overwhelmed in the beginning. We cannot, they're overwhelmed, and we often said, well, we don't want to overwhelm, let's don't give them too much. But then the research says, no, they want the information. They might be overwhelmed, but they want the information. If we give it to them in a concise brochure where they can go at their leisure to go and learn more about deafness or hard of hearing children, it makes it easier for them because we know that those sites have been vetted. They're not garbage. They're not biased. They're going to be good sites where they can learn a lot of great information. Go on. Families ask a lot of questions. Now, this is for you too. So when a family comes in, I'd like to know more about different ways to communicate. Guess what? This resource will give you that information for the family. We're not trying to make you into audiologists or deaf educators. We're trying to help you get these kids into the services that they need, to shore up some of these difficulties we're having with navigating the system. And we know it's because we're a big state and we got a lot of kids. If we have a birth of 400,000, that means 12,000 a year are diagnosed with hearing loss. That's a heck of a lot of babies, a lot more than Rhode Island, I can guarantee you. So use this as your guide to answer questions and resources. Okay. Go ahead. So what we would like you to do now is click onto this survey. It's just a handful of questions. It's very important to us to know that we're providing you the information you need to improve your networks. The goal here was to get you all kind of on the same page and get the resources that you need to improve services for these kids, to get them navigating the system a little bit more easily. But if we're not giving you what you need, we can't help you. So please go to the survey, click on it. And I know we're QR code ladies these days, but it's a great way to communicate back with us what your needs are for any future webinars. Next, we have another slide, please. This is the acronyms I was talking about. We won't go into it, but this is all the list of information just to make it easy for you. Again, print out when we get the PDF, put it in your notebook. I'm not asking you to memorize. I'm asking you just to make your cute little notebooks to make it easier. And thanks again to Lamar. This is the site for Lamar University for that heat map we have of Texas. Didn't leave you a lot of time, but we have a couple of minutes for questions.
And this is Sarah. I want to note that I saw in the chat questions about whether or not people would have access to this PowerPoint. The answer is absolutely. Michaela will be sending that out. So like Karen said at the beginning, we didn't expect you to absorb all of this information. It's a lot. And depending on your role, you're going to want a different type of information. But the hope is that this would be a resource for you, whether you have a hard copy notebook or a digital version. We want you to be able to have access to these resources and just want to communicate our eagerness to respond to any of your questions and to provide any resource that we may have missed, and the importance of completing that survey for our friends at the Department of State Health Services, and thank them again for their support.
Crystal, you asked if we can get the brochure sent directly to the birth screen provider. All birth screeners should have the Teddy brochure provided to their families. Even when they pass the screen, they get a handout. This is sort of part of the legislation that they're supposed to provide these brochures. If the baby does not pass, there's another form that's provided, another brochure. So all birth screen providers and midwives should be providing these brochures.
And Teddy can put those in your hands.
Absolutely. You'll get to them at those links that I gave you. Any other questions?
This is Michaela. Can we stop screen share?
Oh, yes, I'm sorry. Thank you.
Yeah. We'll give you a few minutes if you have any questions. If you don't want to get on video, you can type them in the chat box. Okay. Well, we want to thank you for being here with us today. Thank you so much, Dr. Karen Diddy and Dr. Sarah Wainscott, for sharing all of this incredible information with everyone. We want to remind you that our networking opportunities will continue monthly, and next month we will be meeting individually with each of our regions to continue those networking opportunities for March. We also have those in-person learning summits that have just been, that information has been released. So we hope that you'll be able to join us for those as well. You will hear from, get some correspondence from either myself or one of the other regional contacts in the way of Lana, Paulina, or Tracy, and we'll be sharing all of that information with you if we haven't already. And there is a great question in the chat box. Yep, I see some.
What region, how we can determine it. Michaela, we can give them the map, maybe?
Yeah. Yeah, this is Michaela. Sure, we can share the Department of State Health Services regional map. In short, Region 7 is kind of the Waco, Central Texas, Austin area. Region 8 is the greater San Antonio area. And Region 11 is kind of that Rio Grande Valley area, which is really large. But I'll be sure to include a copy of the map in the follow-up from today's webinar. Comment here about all of the great resources and having learned so much. That makes us very happy. Loving the resources and the QR codes. Fantastic. We want to be mindful of everyone's time, and it is almost at the top of the hour. So we just want to, again, thank you for being here with us today. You have all of our contact information. So if there's anything we can do to provide you with some follow-up information or additional resources, please feel free to reach out to us anytime. Thank you so much, everyone. Have a wonderful day.